Very good morning. I can, 1, 2, 3. Can you hear me? Yeah. Okay. Very good morning, very good afternoon, and good evening, dear distinguished colleagues, friends, distinguished delegates, honorabilities, patients, advocates, scientists, everybody. Today, I am very pleased to invite you to join a very special event for all of us, because this event is going to be delivered on all the levels, from the policy making point of view on the global level, but also from the advocacy side, from the implementation, from academia and patients themselves. Thank you for joining us for this special event focused on better policies, better platforms and collaborations, and better data to strengthen health and other systems which are really necessary to be addressed to close the gap for delivering of cancer care. To be really in line with WHO very well-known quote, to no left one behind. Today's event has a motto delivery, cancer care for all. And let me add with all. On behalf of organizers, I would like to welcome all of you because all of you matters. We know that such complex field and environment as a cancer is not possible to be addressed without all of you and all the levels participation. Communities and families are the key for any transformative leadership in the change for delivering of cancer care. I am a member of WHO board, and I am very privileged to invite together with our colleagues and partners who are today hosting this event. Let me invite children's cancer survivor representing childhood cancer initiatives, one of the key implementing partners of WHO Global Initiative for Childhood Cancer, Mrs. Zuzana Tomashikova.
Thank you very much for this kind introduction. It's a great honor for me to represent Childhood Cancer International today. Being diagnosed almost 18 years ago, I was lucky to be treated at one of the centers of excellence. And we all agree that shouldn't be just a zip code lottery. But once the treatment was over, there was no appropriate survivorship care, especially for adults affected by childhood cancer in their past. Facing the challenges of possible late effects, fertility issues, as well as psychosocial issues, ranging from fear of relapse, issues related to education, career support, financial hardship, but also up to coping with the reestablishing of social life with the peers. One really felt left alone, without any toolkit, not prepared to handle the new normal. Meanwhile, some long-term follow-up services have been developed thanks to the advocacy of Nevertheless, these are mostly local initiatives focusing on the medical conditions only, without sustainable financing and infrastructures, and still absent in many places and countries throughout Europe and beyond. Living in relatively rich Europe, we still face the inequities in access to treatment and standards of care, resulting in gaps in survival rates among countries, knowing that on the global scale, these gaps are even farther. The WHO Global Initiative for Childhood Cancer is a game changer. It's bringing all important stakeholders from healthcare professionals, decision makers, but also NGOs and charities all together. As a survivor's representative, I will be there to bowl and ask you to consider the cure rather as a starting point and not as a final aim. Think of the life after cancer, with all its challenges and support needed for all those children, adolescents, and young adults who are affected by cancer, who have their long lives ahead. It should not be just about the survival, but about the quality of life during as well as after treatment. Patient and public involvement and engagement are fundamental to guarantee that any initiative develops its full potential and so tackles the needs of the most vulnerable ones. Childhood Cancer International, with all its members, is a powerful partner, providing the expertise in lived experience, in advocacy and awareness. We have proven and will continue to meaningfully contribute at every step from regulation development up to their implementation at the local side. Together with WHO and other strong partners such as SIOP and St. Jude, as well as decision makers, we can drive the systematic change, which lead to brighter future for children, adolescents, and young adults affected by cancer and their families, thus to all of us. Thank you.
Thank you very much, Susanna, for your inspiring talk. And definitely we will be addressing to this many times today. Let me just now introduce His Excellency, Minister of Health of Slovak Republic, Dr. Michal Palkovič, to open this meeting.
Dear partners and guests, I am pleased that we have gathered here this morning in order to bring attention to cancer care for all, a topic very dear to me as I am involved in cancer diagnosis on the daily basis. It is truly crucial to discuss, learn, and share new developments, new approaches, given that every 9 seconds, a new case of cancer is diagnosed within the region of EU. We therefore cannot be bystanders with no control over the disease. This is why Slovakia has listed cancer among the flagship agendas during its membership in the WHO Executive Board. During the COVID-19 pandemic, Slovakia has implemented more efficient social support for families and childhood cancer. Likewise, we have introduced home palliative support for each family. And in particular, I am glad that we have made available the complex oncological and social supportive treatment for children from Ukraine, as it's our neighbor. However, there is still room for improvements, especially regarding the data collection that we fairly thoroughly fight within Slovakia. Long-term support and palliative care for children and adults, family members, and with engagement of communities, cities, non-state actors, universities, and patient organization. Further actions needs to be taken by every stakeholder and every country, no matter what the size or geography. In many fields, such as early diagnosis, treatment, and prevention, we still lack a complex approach. That includes also immunization, physical activities, healthy environment, nutrition, and lifestyle. As I have said at the beginning, let's discuss and learn, because when it comes to tackling the constraints and talking about the efficient approaches to cancer, we are in the right place in here. Without further ado, I would like to extend you a warm welcome in this unique side event and wish you a productive exchanges. Thank you.
Thank you very much, Your Excellency, Dr. Palkovič, for these important and very valuable thoughts, but also for all your support in our country and our initiative, also on global level. I would like just now to invite very important, but not only implementing partner, but also co-sponsor and co-organizer of this event, CEO of City Cancer Challenge, Mrs. Isabel Mestres.
Your Excellencies, Honorable Ministers of Health, SICAN partners, friends, it's an honor for me to be here today. For those who don't know who City Cancer Challenge is, we are a Swiss-based foundation that was launched by the Union for International Cancer Control to support countries to achieve the global health targets by working with cities to unblock the challenges, the complexities that bring cancer care along. We are currently working with 13 cities. Soon we're going to be announcing 3 more cities, so we're going to be in 16 cities. And when we work at cities, we work with a multi-layer government approach. We work with the national institutions, national government, regional governments, and local governments. And we bring together the full ecosystem of actors that have an impact in cancer diagnostic, treatment, and supportive care across the city. Together, we generate the evidence through a data collection, and we identify the gaps and co-design, develop, and implement cancer care solutions. They're going to impact the catchment area of the city, but most important, and what we're seeing across every city, it's impacting the national level and scaling all those initiatives to other cities and rural areas in the country. The question is always, again, why cities? Cancer is complex and requires a comprehensive approach. We wanted a community-led initiative, a bottom-up approach. Cities are the minimum viable product for that comprehensive approach to cancer. And specifically, cities play a critical role to reach the vulnerables as we grow population in city, but also reaching out the rural areas, connecting the rural areas with cancer centers, with multidisciplinary teams approach, supporting the referral and counter-referral systems, developing telemedicine options, and working with the community cancer organizations and patient organizations to make sure that the cancer journey supports the needs of the patient. Today, I'm very honored because we have 3 of our countries here represented who we work very closely. We're working with Ghana in the city of Kumasi. We're working in Kenya in the city of Nairobi, and we're working with Georgia in the city of Tbilisi. And I'm looking forward for you to hear how the SICAN model is actually tackling this complexity that is the fight against cancer. Finally, I would like to thank the government of the Slovak Republic for your leadership in putting cancer in the agenda, and most important, to raising the inequalities that cancer is facing within countries and between countries. And I was very, very impressed by your ability to mobilize such a group of governments that are willing to support this event. That brings hope. There's a lot of political momentum. I think there is a time for cancer coming. And also I would like to thank our colleagues, partners at WHO. Your role in coordinating all of us is incredible. Bringing government with civil society to make sure that together we join forces to take all the resolutions that are going to happen hopefully this week into action and improving the life of people affected by cancer. Thank you very much.
Thank you very much, Isabel, for your introduction and introductory words. And it is my very great honor just now to invite someone who is going to give us the roof on the global level, and will be the last speaker of this opening ceremony block. And is Professor Jerome Salomon, who is very dear friend of mine and also former executive board member. And recently he was appointed as Assistant Director General for Universal Coverage, Health Coverage, and Communicable and Non-Communicable Diseases. So, Professor Jerome.
Thank you very much, dear Professor Suvada, dear Joseph, for this kind introduction, and also for the strong leadership of Slovakia and the strong involvement as a member of the executive board at WHO. Honorable Minister, Excellencies, colleagues and friends, I would like to begin by thanking Slovakia for organizing this side event and co-sponsors Argentina, Colombia, Egypt, Lebanon, Malaysia, and North Macedonia, alongside City Cancer Challenge and other key partners. Thank you very much for your leadership and for your valued partnership. This event is a fitting way to start this week when the global health agenda will be discussed and set. It's due time for cancer to be seen as a health and development priority. For too long, we have heard that cancer is too complex or too expensive. And for too long, we have allowed profound inequalities in cancer care to persist. Each year, more than 20 million people are told they have cancer. A cancer diagnosis jolts livelihoods, uproots family stability, and strengthens communal well-being, not for days, but for years and even decades. Cancer is a generational disease, and we must commit to generational action. In the past decade, we have seen what is possible through collective action. Governments, United Nations organizations, and development agencies have increased investments in cancer as a health priority. WHO has launched 3 cancer initiatives, now active in more than 75 countries, and established a campaign to meaningfully engage people affected by cancer. And with more than 300 implementing partners, collectively, we have built capacities. Today, we have stock of what we have achieved and what is on the horizon. A successful mapping, as proposed by Slovakia and other member states, can set the agenda for the decade ahead. This decade will increasingly be marked by the plague of cancer and other non-communicable diseases, and we must act now. Let's chart a way forward that is more inclusive, more equitable. Let's eliminate cervical cancer, reduce deaths from breast cancer, and cure children with cancer. Let's set an agenda based on people like Susanna and informed by data towards health for all. If we succeed, we will have changed the landscape of cancer, health, and development for a generation. Together, we will. Thank you so much.
Thank you very much, Professor Jérôme Salmon, for your very challenging words, actually, because you mentioned something very important. There is no excuse not to make any step forward, not to make and deliver change. So thank you very much. With this, we have the event opened, and just now we would like to continue with the second part of our agenda. And I have the privilege to welcome international organizations which are non-state actors and involving in supporting WHO, but also regional and local national activities to expand the capacity for impact in a reduction of cancer burden through implementation of the 3 WHO cancer initiatives. So I would like to invite them by one, and please join me on the stage. And Professor Guillermo Chantada, President of SIOP, International Organization for Paediatric Cancer. Please join us. And I can give you the floor.
Thank you very much, Joseph. Good morning, everyone. I'd like to thank the the Slovak Republic for the invitation. I'd like to tell you what is SIOP. SIOP is the International Society of Pediatric Oncology. We are there since 1969. We have around 3,000 members all over the world, and we have our mission. Our mission is no child should die of cancer. And so we aim to cure for more children in the world, but also to care for all children in the world. And we won't stop until this is done. We have continental delegations in all over the world. So we have in the whole continent someone that is representing SIOP, who is working also with the national societies, delegations, and governments. So SIOP also has working with the inequalities of care. We are non-state actors with the WHO. So we are already doing a global mapping in the world. So we now have already all the data in Africa, in Latin America, and in Asia on which are the systems that are available for cancer of children. So let us, I would like to thank you again for the possibility. SIOP is here to help. SIOP will be here to support the global initiative for cancer in children. And thank you very much for the invitation.
Thank you very much, dear President of SIOP, Professor Guillermo Chantada. And I would like just now to invite Dr. Ben Anderson and Mrs. Isabel Mestres. We know her already as an important delivery, what they have for us to announce about the collaboration between WHO and CEST implementation for the Global Breast Cancer Initiative. Please be welcome.
Dear colleagues, thank you so much for being here today. As you've already heard from our ADG, we at WHO have developed 3 global cancer initiatives to address childhood, cervical, and breast cancers. The WHO initiatives are now active in 75 countries, providing governments and multi-sectoral actors tools needed to strengthen and scale up cancer control. In childhood and cervical cancers, we are seeing the impact where partners come together around an agenda focused on implementation. The WHO Global Breast Cancer Initiative is the newest initiative, but its 3-pillar foundation is built on more than 20 years of collaborative work. With the involvement of 200 leading experts and 50 organizations, we launched on International Women's Day, March 8, 2023, the GBCI Framework for Action. GBCI has a clear evidence-based goal to reduce breast cancer mortality by 2.5% per year. Achieving this target will save 2.5 million lives from breast cancer between now and 2040. Now is the time for us to focus on implementation and impact. Currently, many low and middle income countries lack access to breast cancer care, resulting in inequalities between and within countries and threatening progress towards universal health coverage and the realization of the Sustainable Development Goals. To implement the GBCI framework, we have multiple platforms of action. One important area of innovation is to leverage cities as cancer care hubs as part of a decentralization network. Together with City Cancer Challenge and the other key partners you will hear from today, we will take the political commitments expressed directly to cities and to affected communities. It is this synergy that is transformational. It is the partnership around this room that will get us to scale. Today, WHO and CEST are very pleased to officially announce the launch of our partnership for the implementation of the Global Breast Cancer Initiative. Today, we are putting into practice the principles that unite us in our aspirational goals to reduce the impact of cancer on humankind worldwide. I welcome CEST's Isabel Mestres to share her vision for this partnership.
Thank you, Ben, for your kind words. And I can't express how happy we are, the whole CEST team and our partners on this partnership to implement such a needed framework, specifically for low-income countries. We bring complementary skills. The framework has been building on evidence, more than 20 years evidence from Europe and the US. And we bring our know-how on how to coordinate implementation in the ground. While SIOP addresses all cancer types, breast cancer has been a priority across all our cities. The framework will help our city stakeholders to prioritize and make the right decisions on system optimization processes and investments. This will ultimately improve access to quality cancer care for all cancer types beyond breast cancer. Our initial collaboration will be focusing across all our cities to build the capacity development, the training, and the improvement of the patient journey that is required to implement this framework. We will then go in deep to 2 of our countries to support improvement on timely diagnostics and reduction on abandonment treatments rates. The ultimate goal is to generate the know-how of the tools for any project manager around the world working at government or civil society organization that wants to implement the framework. We want to give them the how, the tools, everything they need in order to be successful in the ground in their different contexts. SIOP is not alone. We're a group of 40 people around the world working with cities, but we count with over 70 partners and more than 200 experts that are going to be supporting cities to accelerate progress. Among these partners, we have civil society, professional associations, UN agencies, health institutions, and private sector. I want today to make a say to the private sector that some of them are here today with us. SIOP has been working with the private sector since our inception. It has been a very interesting journey, and together we have developed a framework of collaboration to manage the conflict of interest at the same time that they can bring their expertise, their know-how to the table. They bring innovation, and we cannot ignore and not work in partnership with the private sector. 2 months ago, Dr. Anderson and I went to the IFPMA, the Pharmaceutical International Federation, and asked for their support. We needed financial support to implement this framework, and we needed their expertise in best practices on implementation and sustainability. The response was overwhelming from a collective perspective on the industry. In a very short period, we had 4 companies that decided to join collectively to support us. And I would like to invite them here today with us, because we cannot solve this alone. And I want to thank them for their support and also hear from them why it is so important, why they make such a commitment in such a short-term period. And I would like to invite to stage Amgen, AstraZeneca, Bristol Myers Squibb, and MSD to just introduce themselves and say why you're betting on us. Thank you. Look at this. You want to go there? Wherever you feel more comfortable.
Good morning. Excellencies, honorable ministers, esteemed partners, colleagues, and friends. Thank you to Dr. Anderson, Isabel, and your respective teams for convening us and creating an innovative partnership model through this initiative. On behalf of AstraZeneca, I'm honored to join you here today and look forward to strong collaboration around a critical goal, transforming how the world prioritizes breast cancer and its impact on society. In 95% of the countries across the globe, breast cancer is the #1 or #2 cause of cancer deaths overall. Over 685,000 women die of cancer annually. Yet leaders around the world are still not adequately prioritizing it. Breast cancer remains a significant issue for women. At AstraZeneca, we believe that protecting public health and women's health especially, with breast cancer as a foundational starting point, is critical to our futures. Investing in women's health means investing in economies and societies around the world. By actively collaborating with all of you to put breast cancer at the forefront of policies, improving standards of care, and contributing to ending breast cancer as a cause of death, we can address one of the most significant and growing health issues for women across countries, generations, locations, and key societal divides. The time to act, and we heard that, is now, and aligning breast cancer is now. We are excited to work with all of you. Thank you.
Okay. Okay. All right. All right. I hope everybody can hear me. Honorable ministers, excellencies, distinguished partners, guests, and friends. My name is Amadou Diarra. I'm Senior Vice President for Global Policy, Patient Advocacy, and Government Affairs at Bristol Myers Squibb. Our mission at Bristol Myers Squibb is to transform patients' lives through science. And it's obvious that we cannot accomplish this alone. We need all expertise and all stakeholders to make that happen. Everybody's familiar with the say, how do you eat an elephant bit by bit? But I would add to that with the right expertise. Why, to address Isabel's question, I think, first of all, we're not discovering each other today. I think trust is built over time, and we've been given to observe the level of expertise of WHO in terms of framing policy concepts that actually attract multiple stakeholders to work together. And the implementation expertise of CECAN is not to be demonstrated anymore. We've seen this over the past few years, since 2017. And I think for us, it was important to join hands on this massive challenge. And I think that the Global Breast Cancer Initiative could be a game changer, averting 2.5 million deaths, and making sure that beyond breast cancer, this sets a model for other type of cancers and for other non-communicable diseases. So with that, thank you very much for the opportunity to join hands, and I will cede the floor to my colleague.
So we have to speed up. I see the sign. I will keep it short. And I also would like to thank Isabel, who brought us together, and also IFPMA. I think it's bringing companies together is one thing, bringing within the company the right people together is the other thing. And I'm really happy that we achieved to join this initiative for two reasons. The first reason is there is a perfect match in terms of mission. So accelerating access and women's cancer is at the core of this initiative. Secondly, the focus on early diagnosis, so cancer treated early can improve outcomes. And the third element I would like to mention is working on city level. The expertise is in the cities, and we need to start somewhere. We cannot start everywhere at the same time. This is the elephant. Amadou has mentioned, starting in the cities can have a meaningful impact. And therefore, I'm very proud that we have joined this initiative, and I'm very proud to work together with 4 other companies, City Challenge and WHO. Thank you very much.
Thank you very much for the invitation. I'm Sean Lybrand, Executive Director of Access to Healthcare at Amgen. I'd like to have a short video from the head of our unit, Dr. Victoria Elegant. Thank you.
Your Excellencies and Honourable Ministers of Health, esteemed partners and colleagues. My name is Victoria Elegant, and I am the Head of Medical Affairs for the Asia Pacific region and the Global Lead for our Access to Healthcare initiative for Amgen. Unfortunately, I am not able to be with you today, and I would therefore like to thank the organisers very much for offering this opportunity to share this recorded message. I'm very honored to speak today on behalf of Amgen and express our pride to partner with City Cancer Challenge for the implementation of the WHO Global Breast Cancer Initiative. As one of the world's leading biotechnology companies, Amgen is deeply rooted in science and innovation to transform new ideas and discoveries into medicines for patients with serious unmet medical needs, including cancer. Amgen also focuses on removing barriers that limit equitable access to healthcare so that people can live their healthiest lives. Therefore, Amgen is pleased to join forces with other partners to implement the excellent framework developed by the WHO to tackle breast cancer. This is fully consistent with our mission and will leverage the day-to-day efforts of our scientific and medical teams to bring innovative medicines to patients. We look forward to supporting the implementation. Thank you so much, and please enjoy the rest of your meeting today.
Thank you very much.
Thank you, Isabel and Ben, for this commitment to continue tackling health inequalities and contributing to the achievement of SDGs for related with the cancer. We will finalize this session with a message from St. Jude, a children's research hospital from Memphis, from a director of the WHO Collaborating Center for Childhood Cancer, Dr. Catherine Lam. Please can we show on the video? Thank you.
In the city of Memphis, St. Jude Children's Research Hospital was founded as a place of discovery and hope for children with catastrophic conditions. Since we opened, we have delivered on research to move the survival rates for children with cancer from less than 20% to more than 80%. And today, we're glad to celebrate the 5-year anniversary of St. Jude Global, our commitments to extend the science of cure to reach more children from around the world, knowing that for too many children in too many places, survival remains at less than 20%. As part of St. Jude's strategic plan, led by our CEO, Dr. Downing, we have committed $12.9 billion to accelerate growth globally. And so we remain committed to supporting WHO and partners in implementing the WHO Global Initiative for Childhood Cancer, applying the cure-all approach so that we can save 1 million more children. To do so, we know that we need to have all hands in. And from the start, St. Jude has really been founded with the hands and hearts of many cities, with our founder literally traveling across the country, including to 28 cities in just 1 month. Today, St. Jude Global is a tale of many cities, and we're so glad that at this 5-year mark, our St. Jude Global Alliance connects hospitals and foundations in the hands and hearts of many colleagues from more than 200 cities around the world. Fueled then by this power of more than 1 million connected hands and hearts in more than 200 cities, we are confident that we can rocket to new heights as we define new platforms for discovery and for hope. So as a global institution of discovery and hope, St. Jude has committed $200 million to co-design a new platform for access to childhood cancer medicines with WHO, UNICEF, and partners. At the same time, we have proven that we can work together to link policies and governance to meaningful action for children and adolescents. Our St. Jude team has curated more than 1,000 policies in our policy monitor from member states globally, and we're translating policies in system science so that the science of cure can be integrated and embedded into policies, practices, and paradigms, reaching many more children of the world. So from our WHO Collaborating Center for Childhood Cancer Family here at St. Jude, we thank you for partnering and for joining hands to deliver cancer care for all.
Thanks to Dr. Lam, who is actively implementing the program in Pakistan recently. It's the reason why she is not with us. And just now, I would like to pass the moderation to the Dr. Alfredo Polo, Director of Technical Cooperation and Capacity Development, City Cancer Challenge, to facilitate the first panel discussion on the role of cities as a platforms contributing to the approach and appropriate, effective, collaborative, and efficient delivery of the cancer care. Alfredo.
Thank you. Thank you very much. Excellencies and distinguished delegates, may I ask the participants in the panel to go to the stage, and I will be presenting them as they speak. Tamar, Teuta, please take the chair. Mary, please. Bafur, can you take your chair, the stage? Thank you very much. You know, the global burden of cancer is increasing, as we have seen this morning, and it presents a significant public health and development challenge. Every year, around 20 million new cases of cancer are diagnosed worldwide, and vulnerable populations in low and middle income countries bear a disproportionate burden of cancer incidence, morbidity, and mortality. This first panel will discuss the role of cities in improving access to healthcare for vulnerable populations, including those living in rural areas. I will introduce the speakers together with my first questions, so we gain a couple of minutes in this panel discussion. It's my honor to introduce the first Deputy Minister of Internally Displaced Persons from the Occupied Territories, Labor, Health and Social Affairs of Georgia, Dr. Tamar Gaburnia. Dr. Gaburnia, good morning. We have identified cities as innovative platforms for cancer care delivery. How can the private sector partner with healthcare providers, governments, and community organizations to improve access to cancer care in rural areas? And what innovative models of care delivery can be developed to address the unique challenges faced by these communities?
Very much. Well, it's my pleasure to be here and to have a chance to share with you experience of Georgia and how we worked with City Cancer Initiative to improve access and quality of cancer services in the capital town, Tbilisi. So Georgia is a small country with 3.7 million population. 30% of Georgia's population reside in Tbilisi, and in addition, the vast majority of healthcare providers having best infrastructure are located in Tbilisi. So it makes a lot of sense to invest in improving cancer care services in the capital town. This would improve access to cancer care for the entire country population with adequate referral system. And this is what we are trying to do right now. So in terms of partnering with private institutions, so one of the key features of the Georgian healthcare system is that almost 85% of providers are private. So actually we need to partner with them in all directions, including cancer care. Those include hospitals as well as pathology labs and primary care providers. So we need to introduce adequate cancer care policies across different levels of health system to make sure that private providers are well equipped and they have adequate mechanisms in place to adequately diagnose the cancer. And this is one of the major gaps which was identified by the SIOP partners in terms of quality of care and the pathology labs diagnostic capacity. This area requires additional investment, and what was done with the CCAP partner support, it was developing standard operating procedures and protocols for private labs, and we are now in the process of introducing these tools in place. Government is working on introducing an overarching accreditation framework for private laboratories as well as other healthcare facilities to make sure that they align with the best international standards and we have less questions in relation to quality of care. It will take time, and the new policy stipulates that all private providers having contract with Universal Healthcare Program should have international accreditation by credible international bodies, including JCI, Accreditation Canada, a few others, to get contract by 2025. This is going to be a difficult journey, but important is to start and motivate private providers to pay more attention to quality of care, including cancer care providers. CCAN supported us a lot to create a very good platform, which is composed of experts as well as managers of private entities. And this platform created a lot of opportunities for consensus building, dialogue, as well as better understanding gaps in service delivery and developing needed tools and mechanisms for addressing those gaps. This work will continue in the future, and now our priority is to support implementation of tools we've developed with CCAN support, including standard operating procedures and protocols, which we believe would have a very positive impact on quality of care. That's why we understand that it's important to partner with private providers, provided needed incentives, tools, and mechanisms to make sure that we do care for patients, and we do understand that the system should become more patient-centric and to comprehensively address all needs, including needs related to early diagnosis, as well as adequate care and follow-up. This would allow us to improve quality of care, as well as achieve a better patient experience and clinical outcomes. I would stop here. Thank you very much.
Thank you, Tamar. Thank you, Dr. Tamar, very much. Let me introduce now Dr. Merini Angassi. She is the head of the Division of National Cancer Control Program, Department of Non-Communicable Diseases, Ministry of Health in Kenya. Dr. Nyangassi, you have been championing decentralization of services in your country. Can you identify what strategies can cities employ to decentralize cancer care and improve access for cancer patients in remote or underserved areas? And how can they work collaboratively with regional healthcare providers and patient organizations to enhance cancer care delivery across the country? Thank you.
Thank you for the kind introduction. Not sure that.
Yeah, it's working. It's working.
Okay. All protocols observed. I'll give you a brief background of Kenya. In 2019, we had a UHC benefits panel that was commissioned by the government to just look at how UHC can be structured in the country. And one of the significant observations that came out in that report was that cancer was a significant contributor to out-of-pocket expenditure in our country. And so there have been deliberate efforts to see how UHC can incorporate cancer as comprehensively as possible so that we are able to have proper inclusivity of patients. In Kenya, we also observe disproportionate cancer burden affecting women. Actually, more than nearly 30% of our top cancers are actually due to breast and cervical cancer. And so women, we observe even a higher burden in terms of incidence. And the risk of developing cancer in Kenya before the age of 75 years for women is about 18% as compared to men, which is 14 in men. And so you can see there's quite some significant burden in women. Again, in Kenya, the childhood cancer rates are, survival rates are about 10 to 20%. So basically what we are saying is that the environments where we live, work, and play are contributing very significantly to health outcomes in Kenya. So when we look at decentralizing cancer services, we have to be cognizant of the socioeconomic factors that will come into play. For example, how are we making our patients access to care? How do we have targeted programs addressing the most vulnerable? Because these are the people who will fail to come to the facility because they don't have transport, they do not have food, they don't have, structures for educating their children within the facilities. For example, if it's a child with childhood cancer, they are going to be most affected by loss of education, when they're undergoing treatment. So how do we have targeted programs that address the most vulnerable? So Nairobi is actually a new kid on the block for the city cancer. We just completed developing our governance structure, and we have just recently signed the MOU, and we are excited to work with City Cancer to see how we can do our needs assessment in the next phase, so that we can then be able to implement programs around decentralizing cancer care. Nairobi City has a population of about 4 million, which is the largest population in a single county in Kenya. So we believe that having a well mapped out implementation of the city of Nairobi will be able to be replicated across all the other 47 counties in Kenya. So just to speak about the opportunities we see in decentralized cancer care, we are looking at riding on the current government agenda. Actually, we have a new government in Kenya, which is focused on a bottom-up economic transformation agenda. So establishing chronic care models within the communities for cancer will be paramount for us. How do we leverage on working with civil society, patient groups, to be able to strengthen and establish support groups, to be able to have structures for patient navigation, referral, follow-ups, and even to be able to have home-based care for our patients and palliative care. I see this as the opportunities we have, especially if we are targeting the most vulnerable communities. We have large slum communities in Nairobi, and this will make a lot of sense for these patients. Thank you so much.
Thank you, Dr. Nyangasi. Thank you very much. Let me introduce Dr. Bafurawa. He's the director of the Technical Coordination Directorate, Ministry of Health, Ghana. Dr. Bafur, what steps can cities take to ensure equitable access to cancer care for all residents, regardless of their socioeconomic status? Thank you.
Thank you very much. Traditionally, when we talk about access, we're looking at establishing several cancer centers across the country. Ghana has 3 cancer centers, 2 public and 1 private. And over the year, people have to travel over 200 kilometers to access services. So what we've done as a country through, I would say, strategic partnership and political will has greatly contributed to improving access to cancer care. Strategic partnership with organizations and then individual experts have facilitated establishment of multidisciplinary cancer teams in our hospitals, both public, private. So you can be in one hospital and talking to several, practitioners across the country, so that it will also limit patient movement and then also improving access. And this one too has also facilitated development of guidelines that we are using across the country. And then referral system, improving her referral system, that is both forward and backward referral. Backward referral means practitioners are now beginning to move closer to regional and some strategic district hospitals to meet patients so that they don't travel far to access services. And the political world we're talking about is we have a national health insurance, which hitherto was not covering cancers. But now through advocacy and the will of government, the insurance is covering breast, cervical, and childhood cancers. So that has also improved that access, because drugs are now becoming more affordable to patients. And we have a novel arrangement with Roche. In the past for breast cancers, trastuzumab was beyond the reach of average breast cancer patient. But government with partnerships with Roche has brought down the prices substantially to be covered by national health insurance. So that one too is also helping. And our training, postgraduate training, both nursing, pharmacy, and then medical, have all introduced oncology programs that are training the workforce. So increasingly, we are getting more and more people to go out to manage cancers. Where we are now, we are in the era that our challenge is late-stage presentation. So we are making efforts to downstage cancers by our specialists moving up, providing outreach services. So this is where we are now. We are working with our partners to move our doctors, nurses to strategic locations periodically to provide services to patients. So all in all, these are all helping to improve access. So strengthening the health system with all these ingredients are helping to improve access to cancer care to many people.
Thank you very much, Dr. Bafur. Now it's my pleasure to introduce Dr. Teuta. She's the ambassador and permanent representative of North Macedonia to the UN, WTO, and other international organizations in Geneva. Dr. Teuta, you are a doctor, but you are also a diplomat. So what's the role of global health diplomacy in bringing together cities to share good practices and lessons learned, and how North Macedonia is collaborating with other cities across the board in sharing these experiences?
Thank you. Good morning, Your Excellencies, Honorable Minister of Health of Slovakia, dear WHO, dear colleagues from Slovakia, Ambassador, from Ukraine, Greece, Albania, ladies and gentlemen. First of all, allow me to extend my appreciation to Slovak Mission and to my dear colleague, Ambassador Dusan Matulai, for the kind invitation and for the opportunity to represent my country, North Macedonia, at this extremely important event in the margins of WHA. This year, we are joining each other to celebrate 75th year of public health that have improved quality of life of millions of people since the birth of the World Health Organization. Geneva International woke up early on Sunday morning with a walk the talk, Health for All. It was a healthy Sunday where WHO, together with the UN family, member states, athletes, local sport clubs, health partners, and Geneva community demonstrated the importance of the healthy lifestyle, partnership, and solidarity. All of us who work in international Geneva, the capital of diplomacy, may sometimes struggle to explain to our family and our friends what we actually do here. Since I've previously worked as a medical doctor in a clinic for lung diseases and now ambassador to UN, I'm often asked how I might improve people's health. If diplomacy is about negotiation and foreign policy, how does it apply to health in today's world, where health and diplomacy come together? To give an answer to this question, I prefer to quote former US Secretary of State Hillary Clinton, asked, what exactly does maternal health or immunization or the fight against HIV and AIDS have to do with foreign policy? The answer is everything. In global health, there has been a first step taken in better understanding the social determinants of health. In order to address them, there is a need to deal more systematically with the political and commercial determinants of health. We need to enable health diplomats who will ensure that in global world, no one is left behind, that we have strong systems of global solidarity and cooperation. The COVID-19 pandemic has demonstrated the vital importance of global solidarity to confront shared public health threats. The political challenge is the negotiation of global public goods. On the other hand, the key determinants of health lie outside of the health sector. Hence, there is a need to move towards multi-stakeholder diplomacy or new multilateralism, including civil society, academia, policy network, think tanks, the private sector, and many newly formed alliances. Global health is becoming one of the most prominent areas of multi-stakeholder diplomacy. This type of diplomacy encompasses a remarkably wide range of initiatives and institutions, including cities. A new development is the expansion in the global activity of cities and their authorities. Mayors are increasingly representing their cities on the world stage, and international organizations are reaching out to them. While city diplomacy was initially about the promotion of cities, it now includes involvement in the shaping and implementation of international agreements, the most important being the Paris Agreement to combat climate change. Municipal authorities now also engage with WHO on health matters, for example, in combating tobacco use. The role of cities as global hubs was highlighted further by the COVID-19 pandemic. The last, but not the least, it is important to note that success in global health diplomacy is at times also linked to extraordinary individuals. This is why I want to thank you, dear Susanna, for sharing your story with us. It is a story of survival, courage, and strength, but also it is a story that inspires us to learn the lesson, to take actions, to make our politicians listen, to change laws if needed. In 2005, as part of the decentralization process, North Macedonia introduced a new law for the local governance. Despite the recommendations by the public health experts in the country, unfortunately, the law did not grant cities any meaningful authorities in public health. However, this did not prevent different grassroots initiatives that engaged in health promotion and disease prevention projects. In 2010, I had the honor to participate at the ceremony of receiving the Pearl of Wisdom Award at the Cervical Cancer Summit meeting in the European Parliament. The award was given to individuals for their exceptional efforts to prevent cervical cancer, and the winner was a rural municipality from North Macedonia, Sveti Nikola. Together with the award, we were given this brooch that I carry. It was named the Pearl of Wisdom. The pearl represents the woman's uterus, and it should remind us to make the regular preventive cervical cancer checkups. I am about to finish. Okay, so yesterday, at his opening remarks, the UN Chief Guterres reminded us that peace depends on health and that achieving health for all relies on cooperation. Dear colleagues, partners, friends, dear WHO, let's walk the talk. Thank you.
Thank you very much. Thank you very much to our panelists. And I would like to give the floor to Dr. Bente Mikkelsen to moderate the next panel. She is the director of the Department of Non-Communicable Diseases at WHO. Dr. Mikkelsen will guide the next panel discussion. Thanks to our panelists, and you are welcome. May I ask the panelists for the next panel discussion to take the stage, please?
While we are joined by our esteemed panelists, I would like to thank, first of all, Professor Suada, Excellencies, colleagues, friends, and it's really my pleasure to join you today to moderate this ministerial panel. It's a true joy to look at all of you sitting in this room, and I think we feel the warmth of the heart, and it's so necessary. So as the director for the Department of Non-Communicable Disease, I would like to thank you as partners, because we need you. We need to have all hands on deck if we are going to manage these diseases. It was less than 8 years ago when we had the side event on cancer and childhood cancer. And as a community, we have come so far and done so much. And thank you for investing in all the cancer programs. Thank you for your partnership with WHO in its 75th year. And you heard the Director General spoke about this also yesterday. And to set the stage, I have the very, very warm privilege to welcome Dr. Samira Asma. She's the Assistant Director General for Data, Analytics and Delivery, and she will speak to us about the importance of better data for better cancer policies. So, Samira.
Good morning, and thank you, Bente. Honorable Ministers, Excellencies, and colleagues, a very good morning. I would like to begin with a thanks to Slovakia for its visionary leadership and co-sponsors to unite us to take immediate action to deliver cancer care for all, and placing the importance of better data and better use of data to improve health policies and programs so that we can truly make a measurable impact in the lives of people we serve. Data truly is the lifeblood of public health. Data tells us where we stand and what stand we need to take. Public health is often neglected because health successes are generally invisible. Often we are not aware of diseases we don't get because of public health action, and often these are underfunded. So we need to be able to tell the stories of successes and challenges, and we can do this only when we have robust health information systems. As has already been said with regard to the burden of cancer, and 20 million people are diagnosed with cancer every year, and this number is almost expected to rise to 25 million by 2030, taking us away from achieving universal health coverage. But unless we take decisive action, 75% of these 25 million all cancer deaths are estimated to occur in low and middle income countries, further deepening inequalities. And this launch of this initiative is also addressing those inequalities and bridging those gaps. What is also concerning is the staggering gap in the availability of high quality data and health information systems so that we can respond to this growing burden and need and take right timely policy actions. For example, with regard to this initiative, cancer registries are the foundation of cancer control, but are also chronically underfunded, under-resourced in many countries. So a request and a call is, as this initiative advances, it is going to be extremely important that in this information age, we should be able to modernize, digitize our health information systems so that we reduce the fragmentation and make sure the information is used to deliver the right care to the patient, but also for the policymakers to make the right investment at the right place at the right time. So I would like to, again, say that let's together work and redouble our efforts. We look forward to, on behalf of WHO, supporting and partnering. As Dr. Tedros says, we want to embrace partners and partnership. Look forward to working with you. Thank you very much, Bente.
Thank you very much, Dr. Asma, and I hope that you take the time to visit all the web pages of WHO, but also of IAC. Elisabeth Weidepass is here today as well, to really look at the data. So now I have the privilege to hear from our ministerial panel. We welcome the Minister of Health from Argentina, Egypt, and Lebanon, and the Chief Medical Officer of the United Kingdom. And we thank you for your immense political leadership. The world needs you. The world needs strong leadership. My first question is to Your Excellency, Doctora Visotti. What are the primary challenges you see in the effective implementation cancer control policies? And also, if you have been able to overcome some of the implementation hurdles.
Good morning. Thank you for the invitation. I really congratulate the Slovakia initiative, and we are honored in Argentina to co-sponsor this meeting and to work together in this extremely important challenge. I think that the barriers has been told. One of the most important are registers also, and political commitment, and the lack of collaboration, work together. In Argentina, we have National Cancer Institute, and it's a strong institute, and it works in a federal way with the 24 provinces and with the 24 ministries of health of the provinces. We are a federal country, and we have different health sector, the private, the public sector, and the social security. But I think that this is, here we are. This is very, very important in order to, in Argentina, the second cause of death in children is cancer, followed by accidents, and that's why it's a high priority in our country. And pediatric cancer has also to be faced in a very comprehensive way, and in Argentina we are really, really sure that we need better data, and we have a Argentinian childhood cancer register that is we have this register since the year 2000, and according to this register, over 30,000 cases have been registered from 2000 and 2021, and more than 92% of childhood handlers, this register can register 92% of all the children cancer. In Argentina, 7 out of 10 children with cancer recover from the disease, and 80% is taken care about in the public sector, and 20% in the private sector. And I think that one of the tools to turn into these threats to opportunities, in Argentina we have a national law. This law has been delivered in 2022. It has a national regulation, and it's a really comprehensive law, because it defines a national center, pediatrics and adolescent center, and it includes all the children under 18 years old that suffer from cancer, regardless their health insurance, under a comprehensive interdisciplinary patient and family center approach, making coordinated efforts among all provinces and all stakeholders involved, as has been told during the morning. And the interesting thing is not only that we have a national center just to reference and contra-reference to identify, to early diagnosis, and also on-time treatment, but also it has a comprehensive way, because the law enable the access to monthly financial aid for the families, work leaves for parents or legal guardians, full coverage of health practices, oncologic medicines and clinical support, free use of public transportation, access to adequate housings for the whole family in vulnerable situation, and also access for education. It's a very comprehensive law that includes all the ministries of the country, and things not only about the medical care, but also all the social and taking into account the family also. Our coordinated center is our national hospital, which is a pediatric hospital, and also just to finish and to share not only the law, but also the view that we have in Argentina has been told during all the the previous speakers, the comprehensive, the collaboration, the importance of the state, the importance of the social, civil society, the pharmaceutical industry. We need also to include communication in this partnership because it's very, very important. And in federal countries, we work not only with the national government, but also with the provinces that has also to implement the same actions in each area of the country. We have a very, very large country. We have 47 million people, and I can conclude saying that if we work together, we will be stronger, and we need to have this comprehensive approach, and we have to need normatives or framework, just not only to depend on a government decision, but also to install these rights for the people and for the population. Thank you.
Thank you very much. I think we need to really give a warm applause. The example from Her Excellency, I think, is about regulatory measures, the law, the comprehensiveness. It's totally amazing. I'm sure many wants to copy, and it will be very interesting on the second round, if we have time, to know how did you actually make that happen. So strong congratulations to Her Excellency Doctora Visotti. So the next speaker, and we come to you now, Excellency Dr. Ghaffar. We know that certain populations are less likely to access quality cancer care, often the rural impoverishment of those with lower education level. So what has the Egyptian government done to promote quality and innovation?
Thank you. I'm delighted to join you today, and I believe this is an important topic for all of us. And I have to applaud the effort of the Republic of Slovakia for organizing this important event, and all other countries talking about and leading efforts to deliver cancer care for everyone. The importance of cancer, to consider this as a global challenge. And you mentioned a lot of things about quality of cancer care and access for cancer care with good quality to all patients. I believe low and middle income countries, they still have a big problem of accessibility for cancer patients to high quality treatment, as well as sustainable treatment, also for scale treatment to reach everyone. And this is the inequity that we all talk about. I think one important issue to address this is through prioritization of what do we really need to do on a global effort, as well as on the national effort as well. So prevention, early detection is important. Health education is also crucial, and raising awareness of the risk factors for cancer for everyone. In different cultures and in different communities, the awareness and education about cancer is very minimal. What we call it cancer literacy. We need to work more on that. We need to stress on prevention. I think there is a lot of cancer cases could be preventable. Just look at cancer lungs and the incidence of smoking in different countries, and how can we prevent the deterioration and the consequences of lung cancer, and same thing for liver cancer. And we have a very good example in Egypt when we started as one of the most prevalent countries on earth suffering from hepatitis C, and certainly from the consequences of hepatitis C in the form of hepatocellular carcinoma. And in less than 4 years, we managed Egypt to present the file to the WHO to declare Egypt as totally eliminated from virus C. And you can imagine, by doing that, we screened more than 65 million Egyptians, treating hundreds of thousands of Egyptians with free medication. And that's another important issue, that to deliver good quality and access for treatment for everyone and free of charge. We all know that cancer therapy is extremely expensive, and patients is not taking it just once. They have to take it sometimes for life. How can we make sure that we deliver the best treatment protocols, as well as the best treatment facilities for those patients who cannot be able to deliver and cannot be able to afford that type of treatment? And we did that. And now we are not having cases of hepatitis C And we're only dealing with cases that remained from the backlog that happened during the last 20 or 30 years, trying to help them with targeted therapy of hepatocellular carcinoma. So another important thing is screening. So in order to do that, as my colleague just mentioned, the robust cancer registry system. This is an important, and as well as the national network of cancer centers. And we did that in Egypt quite successfully. The programs and initiatives that reflect the political will, very important to have the government, the political will, the high level of the government believe in providing finance to programs for cancer care. Otherwise, you cannot rely on the private sector by himself or the NGOs to do that. Cancer has to be managed by the government and by the financial part of the government. Also, we have to do our national program by preventing and spreading the awareness and training, early detection, evaluation, analysis, and cost. I mentioned about what we have, which we call it the Presidential Initiative 100 Million Health, where we managed to screen more than 60, 70 million Egyptians. And I have also another example to mention, which is breast cancer. When we started our program on breast cancer, we noticed that we discover cases, 79% of the cases we discovered, ladies and women suffering from breast cancer at terminal stage, at grade 4. So we decided to do mass screening all over Egypt for more than 105 million Egyptians, selecting 18 years and old women and ladies in more than 5,000 primary healthcare units by clinical examination, private examination, as well as mammograms. And we discovered cases that they are not aware about, that they had cancer breast. But we ended up, after just a couple of years from this protocol, that we reached 29% of our cases only reached the fourth stage, but more than 70% of cases would be diagnosed early enough to deliver free treatment for them and to save lives and to certainly change the behavior and their family suffering. So there is a lot of initiatives that ensure sustainability and access for treatment that we can share with our colleagues. Thank you.
Thank you. Thank you very much. And cancer literacy, also thank you for bringing in the risk factors and again, emphasizing on the data. Fantastic. So this is an important segue to the sharing of experience improving cancer system in setting with vulnerable health systems. So Your Excellency, Dr. Abiad. So we have asked you a couple of questions, so you know them, but I will tell the audience as well. So how can cancer policies be developed in settings with political instability and in settings where the health system is stressed, including also the care for refugees? And what steps has been critical to developing a national cancer strategy in a country like Lebanon that has existing variation in the quality of and access to cancer? We really look forward to your experience. Thank you.
So thank you very much. And I would like to thank the Republic of Slovakia and the organizing committee for the invitation and allowing us the opportunity to share our experience. Now, just to put things in context, Lebanon is passing through a multifaceted crisis. On the financial level, during a span of 2 years, Lebanon lost more than 52% of its GDP and was reclassified from a high middle income country into a low middle income country. Also, Lebanon hosts almost 1/3 of its population as refugees who have fled regional conflict. Concerning cancer, 2 numbers given by IR on Lebanon. The first one is that 70% of the population in Lebanon are active smokers. And the average age of diagnosis of breast cancer in a Lebanese woman is 10 years younger than that in Europe. So in all of that, you could understand the gravity of the situation and the burden of disease in Lebanon. Now, we all know that it is very important to develop a national cancer plan, and that is in normal situations. But in situations such as Lebanon, developing a national cancer plan becomes essential. And the reason for that is because really we are in a low resource environment. And therefore, it's not only that cancer care is expensive and becoming more expensive, but delay in care or absence of prevention policies means that the cost can be even higher. And that is why it was extremely important for us to use the crisis that we have to set a policy and change direction. Now, in a change management project, the most important thing, I think, is to make everyone realize the urgency of the situation. In a crisis, that is not difficult. And I think that one of the advantages of crises is that the resistance to change is really quite low. The main problem, though, in crises is that the direction of change is something that is not easy for everyone to agree on. And everyone seems to have his own or her own opinion on what needs to be done. What exacerbates that as well is that usually in crises, the level of trust, whether in public institutions or others, become quite low. And that also makes it uneasy for us to align the efforts to do that. Despite that, Lebanon has embarked on a journey to write down our national cancer plan. And I'm happy to say that last week we've finalized the final chapter, and we will be hoping to launch it in July the 6th of this year. And I would like to share with you some of the key elements that, in my opinion, were very important in allowing us to reach this milestone. The first one deals with the issue of trust. And how can we really get trust into this process? And I think here, the main important thing is to rely on science and data. I think that it's clearly important that in this manner, objectivity is much needed. And the use of utilization of well-collected data, well-interpreted data can allow us really to have an objective way and reach the trust of both the stakeholders and the population in general. The second thing relates to collaboration and coordination. And here, I don't think it's just collaboration and coordination on a national level, but with international partners. Also, this becomes extremely important because not only are sometimes technical expertise needed, but also I think the fact that you have well-renowned partners that are considered to be objective with you on the project makes it also more acceptable to the general population. And here, I think I would like to really express my appreciation to the WHO and to some institutions such as Institut Curie, INCA in France, for the support that they have given to Lebanon during this journey. And finally, I think an extremely, extremely important element in doing that is communication and exclusiveness. I think that it's very clear that to be able to get acceptance of your national cancer plan, it's important to be inclusive, bring in as much stakeholders as possible, and to have very strong communication, because in a crisis and when you are dealing with low resource environment, there are, as His Excellency was mentioning, prioritization needs to happen, and we need to be frank with our population in discussing the options that we have and the choices that we make. It is not an easy journey, but I think it is a necessary journey for us to reach better cancer care. Thank you.
Thank you very, very much. And using urgency for transformation, trust, transparency, data, you said it all. Thank you very much. And also we are all very much in kudos for your struggles in your also very challenging situation. So congratulations with the cancer plan. We are mindful of the time, but we have some very interesting speeches still. So we will now go to Your Excellency, Professor Vitti. And the questions for you were, how can patients and caregivers be supported and empowered to participate in clinical research? And how can governments meet the complex need of caregivers who are supporting the care needs of people diagnosed with cancer? That's a big question.
Thank you very much. And Your Excellencies, Honourable Ministers, because of time, I'll be very brief because I think most people would agree on most of the points I'm going to make. I mean, there are a group of areas where we are confident we have a path to a very high level of control, or in some cases near elimination. Cervical cancer has been talked about, head and neck cancers, primary liver cancers. The Honourable Minister has already talked about Hep C, hepatitis B is also in direction. We know what we're doing. We really need to find out how we can do it. There's a group of cancers where the principal problem is one of diagnosis, where if we diagnose early, the treatments are highly effective and people's long-term quality of life remains extremely good. And for those, it is really a matter of concentrating on getting that diagnosis early. There are a group of cancers at the other extreme, where our outlooks are extremely poor. Think about things like pancreatic cancer, to a lesser extent, ovarian cancer, a variety of others. For these cancers, research has got to be the principal aim, and many of the brain cancers would be included in this group. And we should be, we hope, in 20 years' time, looking back on a complete change of our approach to these cancers. But at this point, we have to say the outlook remains quite bleak until that research has been completed. So getting people into that research is going to be central. And then finally, there are large areas of prevention where the research should be, how can we actually drive through improvements? Smoking, we all know about, absolutely drives a lot of cancer, but how can we improve rates of obesity, which are going up everywhere, and drive many of the major cancers, and are therefore going to lead to a predictable increase in the burden of cancer if we stay on the path we're on. Now, these are very different forms of cancer. Some of them, it's good research. Some of them are population-based research, some of them individually based researches. But in all of these cases, I do actually think the cancer community and the public health community have, over the last 75 years of the WHO's existence, been extraordinarily successful. But there are some areas which have been left behind, and I think those now have to be the principal aim. I think in the interest of time, I will not try and cover the rest of the extremely important questions you've asked, because I'm aware many people have to go and hear the Director General.
Thank you very much. And I would like to again thank all the distinguished panelists. And I think the discussion we started today has to continue. And I hope that everybody will actually remember the words that has been spoken. We also, as you also mentioned, there are better days ahead. Using data, using science, looking into what we can do rapidly to eliminate cervical cancer, to cure children with cancer, to detect breast cancer early and treat more efficiently, and to train the workforce, it was mentioned by several of you as well, and deliver essential cancer medicines and technology. So we will take stock of the progress, and we are very, very thankful to the government of Slovakia, who is really holding WHO account, but also inviting for huge partnerships. So it's a pleasure for me to invite you, Professor Tawada, again up to the stage. Thank you very much.
Thank you very much, Dr. Bente Miguelson, for moderation of this very important and I think that historical panel with the thoughts across different levels of development of our global village, but also across different challenges. And I am very grateful for this transparent and very vulnerable atmosphere where we are on the same line, because we know that to unlock the lock is to bring really science, trust, honesty, and care for appropriate collaboration and finding the way how we can deliver cancer care for all. I would like, with the applause, to once again appreciate these panelists, distinguished ministers, for your time, and Professor Witty as well. And regarding to the time constraints, because at the UN, we are going to start shortly with a plenary. So I would like to appreciate once again your commitment joining us. And if you have still some time, you can stay with us for closing remarks. But before, I would like to ask the audience for perhaps two questions whether we do have or interventions. I see a lady here in the first or second line. Please. I will pass the floor to Dr. Roberta Ortiz.
So I would like to introduce the representative from the Ministry of Health of Panama. She's the director of a nursery in Panama, and she would like to address the audience today.
Buenos días, les voy a hablar en español. No, sí.
She will address you in Spanish and I'll be translating for you.
Okay. En Panamá, en cuanto al cáncer infantil, formamos parte del proyecto que desarrolla Jude.
In Panama, we are participating as part of the Global Initiative for Childhood Cancer with the support of St. Jude.
Con la SECOMISCA.
We're part of the Central American Commission on Health.
El objetivo es la detección temprana y atención oportuna de la sospecha de cáncer en niños y niñas y adolescentes.
We are committed to the early diagnosis and awareness of the cancer in children and adolescents.
Hemos establecido una guía que sacamos desde el 2021.
We have a national guideline that was launched in 2021.
Ya fue divulgada con todo el país con el apoyo del programa de niñez y adolescentes.
It has been disseminated throughout the country with the National Program of Childhood and Adolescence.
En la estrategia para la erradicación del cáncer de cuello uterino para el 2030 trabajamos coordinadamente con el programa de salud sexual y reproductiva.
We are working with the WHO Cervical Cancer Elimination Initiative together in our national program of sexual and reproductive health.
Hacia el logro de la estrategia 90-70-90, la cual busca el 90% de niños y niñas vacunadas contra el VPH.
We are participating in the strategy with meeting the targets of 90-70-90, introducing HPV vaccination for young girls.
Hemos ampliado la vacunación contra el VPH entre las edades de 10 a 14 años.
We have increased vaccination for young girls within 10 and 14 years of age.
Estamos trabajando con las escuelas primarias a nivel de todo el país, coordinadamente con los padres de familia y el Ministerio de Educación.
We are working together with public schools, with parents, and the Ministry of Education.
¿Sí? Ok, contamos finalmente, estamos trabajando fuertemente el tema del cáncer cervicuterino, haciendo los tamizajes a través del Papa Nicolau, y hemos establecido metas a médicos generales, enfermeras especialistas en ginecobstetricia y médicos especialistas en ginecobstetricia.
We are supporting the cervical cancer screening by health workforce capacity building, mainly for general physicians, nurses at community level.
Y hemos establecido un plan nacional contra el cáncer desde el nivel normativo del Ministerio de Salud hacia los niveles locales en todo el país.
And we have a national cancer control policy from the central level applied to the whole country.
Muchas gracias.
Thank you very much.
Thank you very much. And let me close officially the event with very brief summaries of what has been really the key message today: cooperation, collaboration, and care. I think that we can really stand with this. and all the others interventions we will share with the informal networking after this event. I would like to very much appreciate and welcome all your interventions, all your effort, what you are doing in your different fields of our global village. And I would like to appreciate everyone joining us today. Have a great day, and please continue with your amazing support for delivering care for all. Thank you.